as far as treatments for Tourette syndrome, I personally just throughout my life I've always thought if I can just stop doing them, it'll be fine. So thinking that I can do it from willpower. I still have tics, of course. So and so there came a point. I think I was in high school at the time when I decided I wanted to see a doctor about them to see if maybe I could get rid of them or suppress them or something like that. And so the first doctor we talked to was more of a psychiatrist, someone who specializes in medicines for psychological disorders, like pills and things like that. So I was describing some of my OCD and Tourette syndrome, my tics, to her, and then she mentioned a couple of medicines as well, but I never wanted to take pills for it. I'm not against medicines in general. It's just that I personally, at the time, didn't feel comfortable taking medicines that would affect my brain, would affect my mind. That didn't sit well with me personally, and so as far as I know, it works for other people. Otherwise, doctors wouldn't prescribe them. So I don't know anything about how medicines work with Tourette syndrome, but I did decide to go see a psychologist. And I had a few sessions with a psychologist. And so it was a different person. I described all of my symptoms to him, and he, trying to remember the things I think I've only went to maybe about 2 or 3 sessions with the psychologist because, again, I felt like my case was mild enough that if I could just get maybe a few tips and pointers, I would be fine. I remember one time he gave me a chart, kind of an hourly calendar where I could record how keep a record of how often I do my tics. And so it's so the psychologist just kind of helped me to become more aware of when my tics were stronger, what times of the day they happen more often. And that's when I noticed that they happened less in the morning, but more in the early afternoon, when I was starting to feel more tired or more stressed usually. Usually I was much more calm. I personally was much more calm in the morning, so tics didn't happen as much. But as it got to after lunchtime, that's kind of when so patterns like that, and that was helpful because then I know the different times of the day when I would need to just take a few minutes, take a breather, and I also noticed too that I can just I can tell myself to stop for a brief period of time. I can just kind of relax or focus on something too. And so that's what I'm aware of as far as treatments. Because I didn't pursue the medicine track, I don't really know anything about how they help or what their side effects are. So that's just something I did not look into at all.